Hello friends, welcome back to Dr. Jaggi's Academy. In today's video, I will discuss today about the urinary tract infections. So, in today's video, I will discuss about the definitions and general features of UTI. Then what are the causative microorganisms? What is the difference between the complicated and the non-complicated UTI, that is urinary tract infection? Then about the pathogenesis and the signs and symptoms of UTI. So now start. What is the definition of UTI? UTI stands for urinary tract infection, and we say urinary tract infection whenever there is some microorganism present in the urinary tract, then we say it is a urinary tract infection. So now it can affect any part of the urinary tract, maybe the kidneys, maybe ureter, maybe urethra, or any part. Okay. So now coming down to the incidence rate in female versus the males. So now you have to remember that UTI, they are more common in females in comparison to males. And the ratio is, you can say, approximately one female out of every 3 females suffer from UTI by the age of 24. So this is such a high incidence of UTI in females. Why? What is the reason? Why females are more susceptible to urinary tract infections in comparison to males? Because of the anatomical difference. This urethra, the length of the urethra is much shorter in the females in comparison to males. That is why microorganisms have to travel lesser distance to reach into the urinary tract in the females in comparison to males. So now we can differentiate UTI into 2 types. One is called as lower tract infection, like when it involves the inflammation of urinary bladder. This is called as cystitis. It may cause inflammation of urethra, which is called as urethritis. It may produce inflammation of the prostate glands in the males, that is called as prostatitis. But there may be the infection of the upper part of the urinary tract, that is called as upper tract infection. That means when there is an involvement of kidneys. Example, we say pyelonephritis is an example of upper tract infection. Now, what are the causative microorganisms that may produce UTI? The most common microorganism is Escherichia coli, E. coli, particularly in the community-acquired UTI. Community-acquired UTI, that means person is not in a hospital, but it is in the daily life, is moving around. So that is approximately 80 to 85% of UTI are because of this microorganism, Escherichia coli, and rest about other kind of UTI, because it is 80 to 85 rest. There is another microorganism which is called as Staphylococcus saprophyticus, approximately 5 to 10% of cases. Others, Klebsiella pneumoniae, Proteus, and Pseudomonas aeruginosa. So these are the microorganisms which are of minor importance, but they do produce UTI. Another is the Enterococcus. So now continuing with the causative microorganisms, fungus, that is Candida, can produce UTI, not in community acquired, but possibly when the person is in the hospital, it is catheterized, or a person is critically ill. That means person is in the hospital, catheters are attached in the urinary tract for the passage of the urine. In that catheter is of you can say the factor which may cause UTI. In that condition, Candida becomes more important. Mostly UTI, they are caused by a single microorganism, but sometimes if the person is having the renal stone, renal catheters, as I told, and the renal abscesses, if these things are present, then multiple microorganisms may be there in the UTI. So now we can also classify UTI into 2 other types. One is called as uncomplicated UTI, and second is called as complicated UTI. Now I will differentiate between these 2 one by one. Now when we say uncomplicated UTI, there is no structural or functional abnormality in the urinary tract. That means urinary tract is normal, no structural or functional alteration. But in the complicated, there is a structural or functional abnormality in the urinary tract. Second thing, because there is no abnormality in the functions of the structure, there is no interference with the urine flow. Urine flow is normal. But in this condition, either there is some stone, there is some catheter, or there is prostatic hypertrophy, which interfere with the flow of the urine. Most of the time, uncomplicated UTI take place in the females. So obviously more common in the normal and healthy females. But this complicated, it may take place in both genders. And as continuation with this one, I told females are the one which develop uncomplicated UTI, and uncomplicated UTI are very, very uncommon in the males. If males develop UTI, it is basically of the complicated type. So males mainly develop the complicated, not the non-complicated. And I just want to add one more thing. If you want to treat these kind of UTI, it is very easy to control these kind of uncomplicated UTI. But treatment is relatively difficult, much more prolonged if it is the complicated UTI. So now coming down to the pathogenesis. So now we will, in the pathogenesis, I will discuss certain points. Number one, what is the route of entry of the bacteria? Second thing, what are the factors related to the host defense mechanism? That is the human's defense mechanism, how it is involved. Then bacterial virulence and the factors predisposing to UTI. I will discuss all these points one by one. First of all, route of entry of bacteria. So now if we take the example of this this is the urinary bladder and this is the urethra. And if I consider these are the microorganisms, these microorganisms can enter from urethra into this urinary bladder to cause infection. If this is the route, then we use our word ascending route. Second, there may be infection of some other organs, like maybe of the maybe of stomach, in the lungs, in the intestine, or any other thing. Then the microorganisms present in the blood, they can go into the kidney through the blood. So these microorganisms enter from different organs towards the urinary bladder through the blood. This pathway is called as descending route. Now, lymphatic vessels can also play an important role. Microorganisms can enter inside the urinary bladder through the lymphatic vessels. So that is called as lymphatic route. So I just want to summarize about the route of entry of microorganisms. Maybe through the ascending route like this one. It may be the descending route like this one, or it may be through the lymphatic route, that is with the help of the lymphatic vessels. Now I just want to discuss another point, that is the host defense mechanism. Normally we say urinary tract is resistant to bacterial infection. That means if the urinary tract is normal, bacterial infections do not happen. Why? What are the host mechanisms? What are the defense mechanisms? Like pH of the urine is acidic in nature. Acidic pH prevents the growth of the bacteria. Second thing, very high osmolarity. Urine has high osmolarity and bacteria cannot grow in that osmolarity. Then high urea concentration. Then normal flushing action of the urine, because urine passes in with a very high speed. With that high speed, whatever the bacteria they are present, they are washed away. So these are the protective mechanisms. If these protective mechanisms are loss of these protective mechanisms may predispose to UTI. So these are the important things. So like what is like inability to completely void empty. That means if the normal this flushing action is not there, urine retains in the urinary tract, then more chances of the infection. third factor about the bacterial virulence. What is the meaning of virulence? Virulence stands for the capacity to produce or induce disease, that is called as virulence. So the bacteria that attach to the urinary bladder are virulent. I will explain this thing. That means the bacteria which can attach to the urinary tract, they can produce the disease, otherwise they will not produce the disease. I will explain with the help of the diagram. Let's say these are the urinary tubules and this is the microorganism. This microorganism, as I told, microorganism cannot stick to the urinary bladder, urinary tubules in the normal conditions. Do not attach. So this microorganism passes out and hence it is not able to produce the disease because it is not able to attach. But if I talk about the E. coli, now E. coli has number of these hair-like structures. These are called as fimbriae, hair-like appendages, which help in the attachment. That means if this E. coli is present, E. coli with the help of these fimbriae get attached to urinary bladder, urinary tubules, and hence because it is retained, it will produce the UTI. So that means I am telling bacterial virulence, that is ability to attach the urinary epithelium, is important factor. Now factors predisposing to UTI. What are the things, if they happen, then more chances of development of UTI? So as I told previously, incomplete bladder emptying, that is obstruction in the urine outflow, is a very important factor in the development of UTI. So this kind of a thing can happen. Obstruction can take place if there is a structural abnormality, like there are some stones, that is caliculi, there are certain tumors, or there can be certain diseases like prostatic hypertrophy, stroke, long-standing diabetes. In these conditions, stroke, long-standing diabetes, the ability to flush out the urine is reduced. Spinal cord injuries, because nerves become non-functional. And other conditions like urinary catheterization, very important factor. If the catheter is attached in the urinary system, then a very important factor for the development of UTI. Then mechanical instrumentation or pregnancy. So these are the factors that may predispose to UTI. So what are the signs and symptoms of UTI? So first of all, as I told, it can be lower tract infection, it can be upper tract infection. First of all, lower tract infection. So the symptoms are mostly asymptomatic. That means bacteria may be present, but symptoms may not be present. But if it is present, then the symptoms are generally located to that urinary tract, local symptoms. What is the major symptom? Pain in that region and burning. Pain and burning during the urination is an important symptom of urinary tract infection. Then frequent urination, the tendency to go for urination is increased. Then more thing, feeling to need to urinate despite having an empty bladder. Bladder is not filled, even then person feels an urge to go for the urination. Suprapubic heaviness, there is a heaviness in the urinary tract, in the pubic region. So these are the, you can say, and sometime in a severe conditions, blood may also come in the urine. Is in severe condition, not in the normal condition. So these are the local symptoms in the lower tract infection. So now signs and symptoms, if there is a upper tract infections. Upper tract infection means when there is an involvement of kidney. So we are having the typical symptoms of lower UTI in the upper tract UTI also. Okay, so the pain, burning, dysuria, those kind of things will be present. Additionally, there will be the fever. There may be the flank pain in that region, not during the urination, but as such pain will also be there. So this fever indicates that there is a infection in the blood that is coming from the kidneys. Now there is another kind of a recurrent UTI. Recurrent UTI means the urinary tract infections are occurring again and again. That means multiple symptomatic infections with asymptomatic periods occurring between them. That means the person is having the asymptomatic period, person is completely free from any symptoms, and then he suffers from an infection. He then becomes completely normal, then he suffers from an infection. These kind of episodes, if they keep on going, then we say it is a recurrent UTI. And UTI may be due to the reinfection, that means the bacteria is coming again and again, or due to the relapse. Relapse means microorganism is not coming from outside, it is still present. It becomes dormant, but whenever it gets a chance, it becomes active. So either due to the reinfection, reintroduction, or relapse, that means the dormant bacteria becomes active. So this is all about the UTI infection. In the upcoming video, I will discuss about the typhoid fever.